As things start to reopen, more kids go back to school. We thought or hoped it would be a good time for a refresher on COVID-19 safety. So in today's To Your Wellbeing, we have the COVID-19 prevention do's and the don'ts. Family medicine physician Dr. Zoe Stallings is with primary care at Pomona. That is a member of the Cone Health Medical Group. All right, so let's first and foremost, since we're doing kind of the 101s and the do's and the don'ts, let's start with the masks. When should you wear a mask?
When you leave your home, have the mask with you. When you're in your car, it's not necessary. However, when you go into buildings, you need to put your mask on. You need to cover your nose and your mouth. Many times people are pulling it down too low. Wear this with you when you're in contact with any other people. As long as you've left your household, you're no longer in your personal space. Going out into the grocery store, the pharmacy, schools, please bring your mask, put them on before you enter businesses and workplace environments.
All right, now we've got when we're supposed to put the mask on, how we're supposed to wear the mask over the nose and the mouth. How do we correctly take them off?
So for a mask that's attached by the ears, you want to just take it off the same way you put it on. Just go ahead and pull it down one strap at a time. However, if you have a mask on that is more of a scarf, pull that down. Don't touch the mask too much. Just kind of pull it down below your chin. It's important that you remember that washing your hands every time you handle the mask is of utmost importance.
All right, so you were saying if we have a regular mask like the one that you have on there that goes behind the ears, we should not take it off this way. Tell me why.
Right. When you touch the front of your mask, what you're beginning to do is touch all of the contaminants that the mask was helping to protect anyway, and then you're more likely to rub your eyes. You're more likely to put your hands in your mouth. So try your best not to touch the front because that's the contaminated surface of the mask.
All right, let's talk about what we do when we take the mask off, where we put it, because the first time that we talked to you, you gave us a recommendation that I still use today. Right.
We do not want you to put your mask just shoving it into your pocket. It would be best if you carry a bag, a Ziploc bag or a paper bag, or a little pouch. Put your mask inside of that bag. Imagine if you put your bag in your pocket and it's mixed up with your money. You have now contaminated both sides of that mask. Therefore, your mask is now dirty. This is a mask to protect you from bacteria and viruses getting into your face and through the airway. So when you shove it into your pocket, stick it into your purse, leave it all over the place, you have contaminated both sides and it's now against your face. So you'll get sick that way too.
That's right. I just think of all of the crumpled up tissues that I've got shoved down into my purse because I have allergies and I don't want that mixing with my mask. So carry that bag with you. Okay, so let's focus now on hand washing. How long should people be washing their hands?
So you want to wash your hands for 20 seconds. And we're talking washing your fingers all the way to the wrist. And to think of that, you can sing Staying Alive by the Bee Gees or Happy Birthday to You. Happy Birthday to You, the entire song is the amount of time that it will take. This is the way that we want you to rid debris. You want to wash off bacteria, you want to wash off viruses, you want to keep your hands clean. You need enough time, and it should be in contact with soap and water the entire time. If you don't have soap and water, wash your hands with hand sanitizer. You want to rub the hand sanitizer, pea-size amount into the middle of the hand or foam until it's dry. Don't need to do all of this air drying. Just go ahead and wash your hands, let it dry before you touch anything else.
Okay, so 20 seconds is still the norm. We are not saying, hey, you can go down to 10 seconds. 20 seconds is a standard for a reason.
Yes.
Okay, so when it comes to social distancing, how far apart do people need to be?
When possible, 6 feet. And even 6 feet in some instances might be a minimum. They've shown studies of what is it like in terms of particulate spray. When we sneeze, how far are the droplets pushed? And so to limit your exposure with someone should they accidentally sneeze, then you need enough space. The other part of it is that if we're talking about surfaces and touching, when we bunch up and use things and touch things, the area hasn't had time for the droplets to even air dry. So give yourself enough space and, if possible, enough time. If someone is in the ATM machine and they're using it, back up and give them space so they can use it, but also enough time that if they've sneezed into that area, it can clear out.
Is it different for the space, the 6 feet, whether you're inside or outside?
I think it's even more critical when you're indoors. However, I've seen where people have bunched up outside on balconies and decks. And so the same thing applies inside and outside. But in particular, when you're inside, try your best to maintain that space.
All right, we've covered a lot of the basics. Are there any other important reminders that I forgot to ask you or missed asking you that you think is something that we need to keep top of mind?
Well, I'm already beginning to talk to my patients about flu vaccinations. We're going into flu season, and it is extremely important that we try to limit getting sick during this time with the flu. We are already demanding the hospital space for patients who have coronavirus. So let's try to prevent another kind of viral illness that we've been dealing with every year, and that's the flu. Also, we're going into allergy season. We're seeing people with the itchy eyes, ears, nose, and throat. If you're someone that has this every single year, be proactive. Go ahead and start your antihistamine, your nasal spray like your Flonase or Nasonex, your neti pot rinses, take your teas, wear a mask to avoid how much pollen and hay you're exposed to.